Senator Art Haywood is on his way, but he is stuck. Apparently there's an accident on the turnpike, so he's not here with us at this point. We're not sure if he will be here at all, but everybody's here, and I just want to thank you all for being here, and thank you for joining us. I am really pleased to be here, and all of us are, to announce the next steps in our COVID-19 vaccination efforts in Pennsylvania. As you all know, last night, President Biden laid out a really bold plan for the country with the goal of making every American adult eligible to receive a vaccine by May 1st. And we are making all kinds of efforts and taking aggressive steps to meet that timeline, and I think we're pretty confident that we can do that. We're fortunate to have the leadership and partnership of President Biden and his administration as we work to protect the people of Pennsylvania. We've already made a lot of progress in the efforts of the COVID-19 task force, the vaccine task force. We're making significant progress and headway in getting more people vaccinated. The special initiative the task force recommended to, I guess about a week ago, to vaccinate educators, school staff, early childhood educators is well underway, and we're making incredible progress vaccinating Pennsylvanians eligible with Phase 1A. Last month, the Secretary of Health issued an order directing vaccine providers administration of COVID-19 vaccines to ensure that Pennsylvanians are vaccinated as quickly and efficiently as possible. Since that order, we have seen impressive improvements in our vaccine infrastructure and our administration rates. Over the past month, we've all seen this firsthand in a couple of ways. First, the vaccination rates are climbing. I don't know if you saw the New York Times today, but Pennsylvania is now above the national average. I think the national average of first doses is 19%. Pennsylvania, I'm proud to say, is 19.8%. This is significant growth in getting people vaccinated. Second, our hospital systems now have enough vaccines to partner with counties to create county vaccination sites. We're starting to see them, such as the one that opened this week in Lancaster, and Senator Ament and I were there, and recently announced site that's going to open next month in Franklin County. Third, as President Biden mentioned last night, we've been working with the federal government to set up 27 community vaccine program sites in the Commonwealth at federally qualified health centers. 4 of the identified sites are already participating in that program, 3 in Philadelphia County and 1 in Lycoming County. Nearly 1 million Pennsylvanians over 65 have received at least 1 dose of COVID-19 vaccine, and more than 72,000 people, this is sort of, must be a 7-day moving average, are being vaccinated every single day. I say that because actually yesterday, 114,835, almost 115,000 Pennsylvanians got a vaccination. So the task force and I are pleased with the strides we have made in the vaccine rollout so far. And we're putting together plans to continue expanding that rollout, making it even better. At the same time, our vaccine allocations are increasing, which really helps this whole process. While we've focused a great deal of attention on the Johnson & Johnson vaccine in recent weeks because that's new, our supply of Moderna and Pfizer vaccines has also increased. And based on the progress we've made and the supply projections the federal government has provided, we're announcing our commitment to the people of Pennsylvania that, to the extent we can do it, the appointments are going to be scheduled by the end of March for those in Phase 1A who want to receive a vaccine, every single one. Our 1A population contains some of the most vulnerable Pennsylvanians, and it is critical that they get vaccinated as quickly as possible. That's going to be great for all of us. The Secretary of Health will be issuing an order today that will require vaccine providers to make the best efforts to schedule all 1A appointments by the end of the month. And when I say the end of the month, I'm talking March 28th, which is actually 2 weeks from next Monday. To assist them in achieving this goal, we're going to be providing greater visibility into their future allocations. This is going to allow them to schedule appointments with confidence, having sufficient supply to keep those appointments. At the same time that we're working to ensure every Pennsylvanian in Phase 1A is able to make their first appointment, make their appointment for their first, at least their first vaccine, we're going to be putting in place preparations for the next phases of the COVID-19 rollout. We've already begun administering the first doses of Pennsylvania's Johnson & Johnson allocation, and as we receive additional allocations of vaccine, we will make sure that all of our teachers, school staff, and early childhood educators have the opportunity to be vaccinated. While Pennsylvania's first allocation of the Johnson & Johnson vaccine was only 94,600 doses, we expect that number to increase dramatically by the end of the month. The next 2 weeks, we're anticipating very conservatively 0 We received 400,000 this week, but we're assuming zero for the next 2 weeks. But then it goes up to 200,000 at the end of the month. In cooperation with the task force, my administration is looking ahead right now, with 2 weeks to go, to make plans for how we can best direct our future Johnson & Johnson allocations. We want to protect Pennsylvanians, and we want to protect all of us, starting with our most vulnerable. After we complete the special vaccination initiative to protect school and child care communities at the end of March, Pennsylvania will use future Johnson & Johnson allocations in 2 ways. First, we will direct part of each week's allotment to supply regional vaccination clinics. And that's going to help make more doses available for eligible Pennsylvanians everywhere. This is going to help speed up our overall rollout, and it's going to let us move through each phase more quickly. We know that county leaders and emergency management organizations have been working hard to put plans in place and make preparations for vaccination sites in their communities. To capitalize on the connections and expertise of county leaders and to make sure our vaccination clinics have the resources and support they need to reach the greatest number of Pennsylvanians possible, we will be working closely with the County Commissioners Association of Pennsylvania, CCAP, to create plans for these regional vaccine clinics. I was just on a CCAP call today, meet with them every 2 weeks, but it was on a call just a couple hours ago, so that this partnership is really important. Let them know how important it is and reaffirm the importance of that partnership. Second, we will direct a significant portion of each week's allotment to additional special vaccine initiatives to help vaccinate targeted populations as quickly as possible. The new special vaccine initiatives will be directed toward law enforcement, firefighters, grocery workers, meat processing, and agricultural workers. Our goal in establishing special vaccination initiatives is to help protect frontline essential workers in the communities, in all of our communities, between now and that May 1st time when everybody is going to be eligible. These workers, their families, and the entire communities they serve are going to be safer if all these folks are vaccinated as quickly as possible. Using the Johnson & Johnson vaccine these 2 ways, the sites and with our priority addition, this will help us speed up the vaccinations for Pennsylvanians in every phase of our vaccine rollout. But it also allows us to utilize flexibility of this vaccine in a very, very targeted way. When I say the flexibility, the fact that Johnson & Johnson is just a 1-dose vaccine, it allows folks to get back into the workplace, get back into the schools faster. We're still working through the details of the next special initiatives, and we're going to announce more information before additional Johnson & Johnson allocations become available before March 28th. We have work to do to get the infrastructure in place to vaccinate these populations, which is why we're starting the process now, 2 weeks ahead of time. I want to thank the COVID-19 Vaccine Task Force for the partnership that they have shown in addressing the challenges of this vaccine rollout. I think we have worked well together. And I thank you as well to all the many vaccine providers all across the Commonwealth who are integral to Pennsylvania's commitment to scheduling appointments for individuals in Phase 1A by March 28th. Without the efforts of the on-the-ground vaccine providers, none of this would be possible. I see Senator Haywood has joined us. Congratulations, you made it. Good to have you here. It's good news, and we will continue to receive more vaccine in the coming weeks, and it will give us new opportunities to expand our rollout and get the vaccine to every Pennsylvanian who wants it. Now it is my great pleasure to bring up one of the members of the task force, Senator Ryan Ullman. Senator Ullman.
Thank you. Thank you, Governor, and good afternoon. Today represents another significant step forward for the people of Pennsylvania. After over a year of uncertainty, and though we recognize that much work remains, today we're able to look forward and perhaps get a glimpse of the end, see the end. This commitment today from the COVID-19 Vaccine Task Force will allow all Pennsylvanians who wish to be vaccinated to have greater access to vaccine, to more quickly achieve herd immunity, and ultimately restore and rebuild a stronger Pennsylvania. The vaccine supply is increasing, and we will continue to increase. Every Pennsylvanian in Phase 1A who wants a vaccine will have access to it by the end of the month. And the improvements this task force has made to the vaccination distribution process is expected to yield tangible and rapid results for all Pennsylvanians seeking the vaccine. I recognize that these are bold commitments. The people of Pennsylvania expect us to come together and deliver results. The opportunity to visit loved ones again, to return children and teachers to the classroom, to celebrate weddings and attend concerts. These will all be possible again soon as more and more Pennsylvanians receive the vaccine. As I said at the Lancaster County Mass Vaccination Clinic on Wednesday, I do believe a spring of hope is upon us. In closing, I'd like to express gratitude to my colleagues on the task force. I'm confident that the improvements that we've been able to make thus far are the result of the collaborative and bipartisan nature of this task force. Much work remains, but we are turning the corner and dramatically improving the process to ensure any Pennsylvanian who wishes to be vaccinated has access to this vaccine. And it's now my pleasure to invite my Senate colleague, Senator Art Haywood, to the podium.
Thanks, Ryan. Thank you so much, everyone. I was delayed on the turnpike due to a terrible accident, and I certainly hope there were no fatalities, and pray for all those who were involved. I want to thank Governor Wolf and the task force for all that we've been able to do. It looks like President Biden scooped us again, indicating he's opening the faucet, the vaccine faucet. And our plan takes advantage of the vaccine being more widely available. It will allow the vaccine to get to the seniors in the hardest hit areas of our state, including southeastern Pennsylvania. These regional clinics are critical to getting the vaccine out. Our plan also includes getting vaccines to grocery store workers, food processing workers, many of whom are Black and brown. We can and will achieve equity, but we will need your help. Please get vaccinated when your turn comes. Let us know your race and ethnicity on the form when you register, so we can know who is missing. All the vaccines are safe and will prevent hospitalization and death. All of them. I know the anxiety is high. I hear you. Last night I was on a Zoom with the outstanding Montgomery County Chair of the Board of Commissioners, Dr. Val Arkush, and she said, we only need vaccine. The faucet is opening. Thank you. And now I turn it over to my good friend, Bridget from Scranton.
Thank you, Senator. Thank you. Good afternoon, everyone. And my name is Bridget Malloy Kozarowski. I'm a representative from the 114th Legislative District in Lackawanna County, home of Scranton, PA. I once again would like to start by thanking Governor Wolf, Acting Secretary of Health Beam, Director Padfield, and my Senate and House colleagues that make up our joint task force for all your collaborative efforts in prioritizing the health and safety of our residents across the state. Last week, as a task force, we announced a special initiative that prioritized the health and safety of our teachers and our students across the Commonwealth by securing and allocating the 94,600 doses of Johnson & Johnson vaccines. Educators, school staff, early childhood educators across Pennsylvania are currently being vaccinated, paving a way to get our children back into the classroom. With this 200,000 J&J weekly doses coming to Pennsylvania starting the week of March 28th, and our supply of Moderna and Pfizer continuing to increase weekly, today's announcement is another special initiative that again is a step in the right direction to not only protect our most vulnerable population, but also speed up our vaccine rollout. Through the regional vaccination clinics, we will achieve greater access for seniors who have been struggling to find available doses and a more equitable distribution by allowing communities to direct doses to their most vulnerable residents. Beginning in April, we will also be able to target our frontline essential workers who have had no choice but to continue serving our Commonwealth amidst this pandemic. I mentioned last week that it is going to get better, and I still stand by that because it truly is. I need for everyone listening today to know that by mid-April, 80% of our 1A population will be on track to being fully vaccinated. Please stay safe and continue to take universal precautions as we navigate this pandemic. Thank you. And it's my pleasure to introduce my colleague in the House, Representative Tim O'Neill.
Thank you, Bridget. I'm pleased to stand here once again with my colleagues as we take another important step forward into getting shots into the arms of those who want the COVID-19 vaccine. In just over a week, we've made great progress and are beginning to see success. Many teachers have scheduled their vaccinations, and some have already begun to receive their shots. Also, last week, the governor signed into law my legislation to involve the National Guard in distribution and administration of the COVID-19 vaccine, and we're now using their logistical expertise to better position the shots and speed administration. And as of yesterday, we're actually ranked 38th in the nation for the percentage of vaccines administered compared to the amount received, according to Becker's Hospital Review. As many are aware, we've been ranked in the 40s since the beginning of the vaccine rollout, and although, and the governor and I were discussing this earlier, although 38 still isn't good enough, 38 is on the way to where we want to be. I know that concerns still exist around vaccine supply and distribution, but as you heard just a few moments ago, everyone eligible in Phase 1A will have the opportunity to make a vaccine appointment by the end of the month. And now we will be moving to open up opportunities for others as well. I'm ecstatic that our essential workers and first responders who carried us through since the early days of the pandemic will have the chance to be vaccinated as well. We owe these firefighters, police officers, grocery store workers, postal workers, manufacturer workers a debt of gratitude. They reported to work day in and day out. They risked their lives to make sure we were protected and had the necessities of daily life. And there was no teleworking for them. And they did this all without complaint and with very little thanks. They have been waiting a long time for this additional level of protection, and I'm happy we can give it to them soon. I'm hopeful, too, that we will continue to make significant steps forward in the coming months, so every Pennsylvania who wants a vaccine will have the opportunity to get one. And as was mentioned earlier, President Biden opening the doors by May 1st is huge news when it comes to vaccine availability. So in closing, again, I'd like to thank my task force members for your efforts. We've shown how much we can accomplish when we work together in a strong, bipartisan, collaborative manner where all ideas and suggestions are welcome in order to move Pennsylvania forward. I'll turn it back over to Governor Wolf.
So thank you, Representative O'Neill. Thank you, Representative Kozarowski. Thank you, Senator Ament. Thank you, Senator Haywood. Again, I think this group we've all worked together, and I hope you feel as I do that we have really made some great progress. So thank you for your dedication. Okay, open it up for questions. Kevin.
We will now begin the Q&A portion of our press conference. We will begin with Sam Rowland from the York Daily Record. As a reminder, please identify the speaker to whom you want to ask the question. Sam, please unmute and ask.
Thank you, Governor. My question is for you. I wanted to know how you guys will make sure that everyone in Phase A did get their vaccine. I know that you say you wanted everyone scheduled by the end of March, but how are you actually going to measure that to make sure that that goal is reached?
Now it's 1A, and it's
1A.
and it's going to be those who want it. So if you don't want it, I'm not sure how we're going to know that. But we will know, and we figure the number is somewhere around 80% of the 4.5 million people who are actually in 1A are going to want to have the vaccine. And we are asking the providers to track that. So when someone comes in, they have to show that they are in 1A, that they have a right to be in that priority category. And each of the providers we follow up, the Department of Health follows up. So we will do the best we can to make sure that everybody who wants one, again, in 1A, gets one, has that first shot, either has first shot or an appointment to get that first shot, or in some cases will have gone through the whole process, the second shot. I think as Representative Kozarowski said, we hope that everybody has that second shot by the end or by the middle of April, because you have to wait 3 to 4 weeks to get that second shot. But the Department of Health will be working with providers to capture that information.
But with supply and demand and just all the problems that some people have had trying to get those appointments, is there any targeted efforts to track it that way for those eligible in Phase 1A?
Well, we will be asking the providers to tell us how we're doing moving those waiting lists down. I mean, the waiting lists are a function mostly of lack of supply. And as we go through the supply increases that we foresee between now and the end of April, we should be in a position that Pennsylvania should be very able to meet the goal that President Biden set out last night, that supply and demand will be at a place where anybody who wants to get an appointment will be able to get one. There will be should be no waiting list by the beginning of May.
Okay, thank you, Sam. We will now move on to KYW. Jim, go ahead and ask your question.
Hey, Governor. In Montgomery County, for example, there's 137,000 remaining in 1A. They're just scheduling people who signed up on their list on January 14th. I notice you say make the best efforts to sign people up. How confident are you that in all counties, especially here in southeastern PA, that they'll actually be able to schedule everyone in 1A who wants it by the end of the month?
I'm very confident. And you're right. The January 15th date, if you think back to January 15th, we were getting nationally 5 million doses a week. We're now at the point where at the end of this month we'll be between, according to the White House, 20 to 22 million per week. And wait lists shrink a lot faster when the supply is 3 times what it was back in January 15th. So I'm very confident that the supply is moving, and I'm very confident that the capacity of our logistical team, the pharmacies, the sites that again, I visited, Senator Ahmet and I were at one on Wednesday, that we have the capacity to actually, as the supply increases, that we can roll this out. We're ready. And I think those waiting lists will shrink very quickly.
I understand what providers get on March 22nd is what they can expect each week for the next month. When can they expect to know what that number will be on 3/22?
3/20, right, they know it now. The federal government actually gives us a 3-week timeline. So every Tuesday, I guess, they come out with a number, a general number, and you can sort of figure what your proportion of that is. Your portion of that is going to be. But in the conversations I've had with our providers, they have actually gotten to the point now where they actually have certainty with their vendors, and that is really helping the throughput.
Thank you, Jim. We're going to now move on to NBC 10. Deanna, please unmute and ask your question.
Good afternoon, Governor.
Hi,
I'm hearing
Deanna.
from some counties and providers that they have not been notified as to what they can expect over the next 2 weeks. And when you say make an appointment, do we have any idea how long those appointments then will be? I mean, we all know we can call and make an appointment for our car to be serviced, but we don't know if we're going to be booking that tomorrow or next January. So we can play with the numbers saying that we can get an appointment, but are we saying that people are going to be getting in within a certain time frame? And can you answer the fact that providers are saying they're still not clear as to what they're getting and when?
Yeah, I don't understand that because I know what the Commonwealth is getting, and I'm assuming that the providers I've talked to said they do know what they're getting. So I'm not sure why there is that problem that you're talking about. in terms of the appointment time, you're right. I mean, if it's one thing to say if you have an appointment, it's going to be a long time out. That doesn't mean anything. No, we're talking about appointments within a reasonable period of time.
We've heard from many frontline workers that say that they didn't have an opportunity to get a vaccine, that they've been there this whole time. They can't stay at home, as you mentioned. And some of them feel a little slighted that there were other groups that were moved up ahead of them. What do you say to those vital people who have been working this whole time? You know, that teachers were moved up before they were moved up, for example. I mean, we understand everybody wants to get back to work, but for some of those people that are of the lower income end, that are working multiple jobs, what do you say to them that they're feeling frustrated and they're not sure that they're still going to be getting this vaccine, you know, in the next 8 weeks or so?
Well, no, that's why we announced today that within the next 2 weeks, they will start to get them. The fire and police and the food workers, both the retail and the production workers. So we are trying to do, that's exactly what today's announcement is about.
All right, we're going to move on now to the Associated Press. Mark, please unmute and ask your question.
Good afternoon. This is really for any of the task force members, but when you're talking about the sort of the next group, the firefighters, police, setting up the infrastructure for that, can you provide any details about, on a practical level, what that would look like? Will it be similar to what's going on now with teachers and these IU units? Do you know where people are going to be sent to get them?
No. And the teachers were a lot easier because of the IU units, and that's why we're doing this now, 2 weeks ahead of we don't think we're going to have the Johnson & Johnson vaccine available for another 2 weeks. So we've given ourselves 2 weeks to figure all these things out, to figure out exactly where you go if you're a firefighter, where you go if you're a police officer, where you go if you're a food worker, and how we do this in a way that's as convenient as possible. So those are the things we need to work out, and that's why we've given ourselves this amount of time, just to signal that it's coming. It's not going to be 6-8 weeks. It's coming soon, and we intend, we're meeting twice a week to make sure that we have a system that allows that. Anybody else want to add to that? Tim?
Yeah, I'll comment on that. It's really going to be a wide range of ways that we approach this. You know, it might be a specific way for the police officers, and yet it's a different situation for food process workers or grocery store workers. In some instances, there's no doubt we will be taking the vaccine to them. In other instances, we're going to be establishing and utilizing this concept of the regional clinic in order to maximize the efficiency of the various resources we have available. Of course, I anticipate PEMA and the National Guard to be a vital resource when it comes to rolling this next phase out, and so it's really going to look different for each specific segment of the groups that are targeted. But we're, as the governor just indicated, we're working through those details right now to ensure that we get it out as quickly as possible. Thanks.
Okay, we're going to move on to Bill Kibler of the Altoona Mirror. Bill, go ahead.
Hi, on a little different track, can you give a sense of the interplay that has occurred between the Republican members of the vaccine task force and the Democratic lawmakers and administration officials? Has it been cooperative?
Are you kidding? Yeah, it's been really very, very collegial. I think I keep saying this. I don't know. It's certainly it's been a wonderful experience for me. Art, you want to say? You want to say something here?
It's been wonderful.
Anybody else want to comment?
You know, I'll be honest, being the Republican from the House member, coming into the task force, I had no clue what to expect. I didn't know if it was going to be a legitimate task force that actually got some work done, if it was just a window dressing to say we were working together, and to be completely forthcoming. It's been a wonderful experience for me personally to be involved in this effort, to actually come up with with solutions for the Commonwealth. I've been extremely pleased by the progress of the task force. I personally feel like we all speak our minds openly and respectfully in the task force, and yet we're able to set aside just partisan bickering, and we're able to get the work done, because, you know, I've said it in the last press conference, this is what the citizens of Pennsylvania expect when it comes to the biggest issue that the Commonwealth is facing.
And if I could ask a follow-up question to the governor.
No, go ahead. We're not ready yet.
Just very briefly, I wanted to add to it. I don't want to take the governor's follow-up. But no, to follow up precisely what Tim and the others have said, I've been extremely pleased. Was not sure what to expect at the outset. As Tim said very well, it doesn't mean we don't have disagreements. We do disagree, and I think that's at the heart of civility. Civil political discourse is the fact that we will have disagreements, but we're able to disagree well and actually bring ideas and solutions to the table. So I think we've worked extremely well together. We all recognize there's no higher priority in the near term to ensure that we're getting, again, young people back to school, parents back to work, restoring and rebuilding a stronger Pennsylvania. The people of this Commonwealth expect results, and we're committed to working in a bipartisan way to do just that.
Just one more. One more.
I better get up here and say something, or you'll think I didn't get up here and I don't agree with them all. So, no, we've been very pleased. We've been very productive. This, like Representative Tim O'Neill said, it's one of the biggest challenges the Commonwealth has ever faced. So I'm very pleased with the production that we've been able to be as task force members, and we've been able to bring back our caucus's concerns and work them out. And so far, so good. Thank you.
And then, Governor, can you say, given the cooperation that is occurring, would it have been better in hindsight to have maybe solicited Republican cooperation earlier in the pandemic?
Yeah, I don't know. I mean, this is a formula that we've alighted on, and I think it's really helped by the fact that, as everybody said, we're all in the same place here. We recognize we need to get these vaccines out into arms as quickly as possible so that we can get back to life as normal. And that's not a Republican or a Democratic thing. And so maybe that made this easier. Maybe there's some issues that are a little more intractable than the issues we're dealing with here. But yeah, this is I think this is the way democracy is actually supposed to work. You know, we come in, we disagree, and the act of disagreeing, we actually make the output better, because we get fresh ideas from different places. So it's a great model, and maybe we ought to be using it more universally in everything we do here in Harrisburg.
We're going to continue moving toward the west. Mick from the Pittsburgh Post-Gazette, please ask your question.
Hi, thank you. I was wondering a bit about vaccine phases. It seems like there's been a lot of moving around with who's going to receive the Johnson & Johnson vaccine, and I'm wondering if there is any kind of timeline to move to phase 1B, or if it's basically just going to be from phase 1A, and then a month and a half from now, everybody will be able to get the vaccine.
Well, I'm pretty confident that everyone will be able to get the vaccine. You know, everyone will be eligible by May 1st, as the president laid out. We can meet that timeline. I think we expect to be through 1A pretty much by the end of March. So that leaves most of April, when whatever the next categories are, 1B, or maybe we get to everybody sooner. I think that's one of the things we're going to have to decide, how we want to move through the 1A and the essential workers before we get to May 1st. So those are questions that I think are really good ones. We want to get everybody vaccinated as quickly and fairly as possible. That's what we're all trying to do here.
And I know that we're still a ways away from really rolling back restrictions, but I'm wondering exactly what numbers the state is looking at when it's going to come time to maybe open up venues or concerts and things like that. Are you looking at case data, or is it going to be more looking at death data and waiting for deaths to drop to a point where it's more like the flu or other seasonal illnesses?
Yeah, we're looking at all those things. Also looking at the temperature, the vaccination rate, One of the things that I keep looking at is the hospitalization rate, and that keeps coming down every day. I mean, there's some days where it comes up, but the moving average keeps coming down very nicely. I think we still have a ways to go. I think the CDC is right that we have had a tremendous drop all across the country, including here in Pennsylvania over the last 8 weeks. But we're still at a level that is too high, and I think we want to get to as well as we're doing right now, as good a job as I think we're doing. I think we want to get to a point where we're all feeling that there isn't going to be another upsurge, that we can actually get back to life as normal. We're within striking distance of the finish line. I just don't want to stop the race before we get to that finish line, but we are almost there, and we're looking at things and have already started opening things back up as we speak. As you know, the indoor event limit has gone up dramatically, so has the outdoor event limit. Out-of-state travel, that prohibition is off. So we've already started reopening, and the question is how fast can we do this? And I just want to do it as safely as we possibly can, but we're within striking distance of the finish line.
Okay, our next question will be from WGAL. Tom Lehman, go ahead and ask your question.
Governor, a lot of people say they're still having problems scheduling appointments. I know providers knowing how much supply they're going to get plays a big role in making appointments, but what kind of assurances can you offer people in phase 1A that there's going to be enough supply for them so that they can get an appointment before the eligible pool expands?
Well, again, that's what today's announcement is about. We are saying that by March 28th, you shall have a shot, at least one shot, if not both, or an appointment. So the certainty is what we're talking about here today. I mean, that's what we're all trying to get, and I think we're comfortable in making this a goal because the supply is increasing really rapidly of vaccines, and the capacity of our logistics, our distribution system, I think is growing with each passing day.
Okay, our next question will be Bob Mayo from WTAE. Bob, go ahead.
Hi.
Hi, Bob.
Thanks for talking with us. Can you hear me?
Yeah, hi.
Okay, hi, Governor. Thank you. Over time, 1A had the addition of older Pennsylvanians over 65 and people in certain higher risk groups. Now that we're seeing a compression or a timeline for the transition to 1B, do you anticipate over the course of either the next 2 weeks or once we get into May, any shifting of any other age groups into 1A or 1B, or do you think that the current structuring will remain in place but with a timeline in sight? And one other question, for people who are in 1A, the older groups and the people who with certain health conditions, if they haven't signed up yet and they make a late decision after going into April or whatever, do they still get priority at that point, or are they just part of a larger pool, someone who's in a 1A group but decides late, okay, yes, I want to do this?
Yeah, no, the 1A will have priority no matter when they sign up. The assumption, my assumption is that they want to get there as quickly as possible so that there won't be that many who are trying to get onto a list or get a shot after March 28th. But if there are, for whatever reason, yeah, they'll still be 1A. I'm sorry, Bob, what was your other question?
The other question is, do you anticipate any shifting either by age groups or other categories being moved into 1A or 1B before that golden moment comes in May when it's available for everyone to sign up?
No, but I don't know, because I don't know how fast we're going to proceed from where we are to that May 1st timeline. If we're there sooner than May 1st, then you know that'll be a great thing, and there will be some changes. But I don't think at this point we know enough about where we'll be 3 weeks from now in terms of supply and our capacity to vaccinate people to be able to say right now with any definitive way, in any definitive way that we're going to make changes. We just don't know.
Okay, we're going to move on to the Scranton Times-Tribune. Boris, go ahead and ask your question.
Hi, Governor.
Hi, Boris.
The regional aspect to this, the vaccination clinics, how large are these regions going to be? When we did testing last year, there was some emphasis on the Department of Health districts. So how large are these regions going to be? And wouldn't it be better to have a mix of county by county or like smaller regions than having like a district-wide region?
Yeah, the health department regions are based on administrative issues and priorities with the Department of Health, not on the ease of getting a vaccine. We want to make this as easy as possible. Now, again, we recognize that there are going to be people, no matter where you put it, even put it next door, that there's going to be a problem to get a vaccine. So we want to make it so that that in some cases we'll have mobile sites that can go to places. These mass vaccination sites will be with the intention of getting people who have some amount of mobility and they can get to these sites. And we will look for ways to allow people to go to their local pharmacy. If we need to find other ways to make it even more convenient, we will do that. But this is just one of the legs of the stool that we're using to try to make sure that we get vaccines out to everybody in Pennsylvania who wants one.
Have they defined those regions yet?
No. That's why I'm announcing that we're doing this today. We have, some time to figure out how far people should travel. It's going to depend on population density. It's going to depend on who needs the vaccine and where they live. So we have some work to do here.
Okay, we have time for one more question today. We're going to go to ABC 27, and Dan, go ahead and ask your question.
Hey, following up on kind of what you were saying about, mobile vaccinations and whatnot, have you guys considered the people who are, especially many older Pennsylvanians who are homebound?
Yeah.
Is there any plan to get vaccines to them?
That's exactly the population that I was talking about. I mean, the shut-ins, folks who really can't, for whatever reason, can't get out. We understand that we're going to have to figure out ways to bring the vaccine to them. And so mobile sites might be, mobile delivery systems are one. There might be things that I haven't thought about yet that we'll bring up, but I think all of us recognize that is one of the challenges that we have to make sure that ultimately everybody who wants one of these vaccines is going to be able to get it no matter what condition they find themselves in.